You want to get back to our alternative media show?
Let's do it. The Pearl Jam of financial media, right here from the Bull and Bear Bar.
It's a small business healthcare summit right here on Happy Hour, folks. In the one corner, we have Patty Briguglio, and she dared to wag her finger at President Obama when she wanted answers for what healthcare reform would do to her small business in North Carolina. She was like, "You better keep your promise, Mr. President." And then in the other corner, the small business advocate for Obamacare is David Boris. He owns Hell's Kitchen Catering in Chicago. He is for the public option and healthcare reform overall. Welcome to both of you to Happy Hour. David, let's start off with you. You know, I was reading some interesting statistics, and you were mentioning that yourself, that your health care premiums, you know, what you have to pay to cover your employees continues to go up, and they're predicting that health insurance rates are going to go up 10% for small business owners like you. So I guess that justifies why you want something changed.
Correct. Well, you know what, and thank you, by the way, Eric and Cody and Rebecca, for having me here today. Our premiums have doubled over the last 7 years. When it comes due again in several months, we're anticipating another 10 to 14% increase. It's not sustainable. My story's not unique. This is going on in small businesses all over the country. So I am working now with a group of small businesses, about 6,000 small business owners in about a dozen different states, 600 just in Illinois, called the Main Street Alliance. And yes, we're advocating for a public plan option that we believe will inject true competition into the marketplace and start to enable us to be able to see premiums that will be relatively stable and predictable.
Patty, you know, I think the big problem that most of us I'm a small business owner too, and you know, I struggle to provide health insurance when I can. And as I look at that in my own business model, I get freaked out because I don't see any solution from either side of the aisle, whether it's a public option, a co-op option, or the status quo. Patty, what do you got for me? Do you have some hope?
No, I don't. I mean, does anybody in their right mind really think that involving the government in our health care is going to make it more affordable and cost effective? Because if you can give me any government program that is cost effective and efficient, I'm willing to listen to it. And these people with the Main Street Alliance, I went on their website today, looked at their information, and I represent the 27 million small business owners across the United States who have been emailing me, calling me, tweeting me, telling me that they want the government to stay out of this. We're scared to death.
Sure. I understand that. But as a small business owner, I mean, I imagine you also struggle to provide health insurance to your employees. And if you're facing these double-digit rate increases, maybe it's not the public option, but we need something to be done, or your company may go out of business.
Rebecca, you're absolutely right. But what we need to do is we need to talk about opening health care and opening it along state lines. We need to have small business at the table talking to the government, talking to Congress, talking to President, instead of them just, I mean, when has anybody in Congress ever had to make a payroll? They don't understand, and they're talking about a surtax of 8%. I don't know about David, but I don't have that much of a margin that I can have the government hit me for 8%.
Well, let's talk about what that surtax is, because let's talk about what we're talking about here, because there's a lot of misinformation being propagated around this conversation. What we're talking about is, right now I'm paying 13% of my covered employees' payroll. If I can't achieve some sort of affordable premiums, what we're talking about is me being able to say, all right, I'll pay 8% of my payroll as an employer contribution toward my employees going out into an open and transparent exchange where my employees could choose either a private insurance plan or they could choose a public plan. I think it's critically important that what we're really talking about here is injecting competition. 94% of the insurance markets,
David,
me, but 94% of the insurance markets,
David and Patty, guys, we're
94% of the insurance markets in this country are deemed non-competitive.
Well,
what we
that's
need to
just
do
it, David.
is see some competition in those marketplaces.
David, we have antitrust laws, but the insurance company, the healthcare insurance company, is exempt from them. All we got to do is enforce the frickin' laws on the book. What do you say, David and Patty?
Exactly.
I'm going to have to wrap it. You guys get one quick last word each.
I don't see where that conversation is right now. I'll tell you what I see.
It's true.
I see small business owners like myself that have been taken advantage of. And small business should be at the table.
Small business needs to be
I
at
was
the
in
table.
Washington,
You need to
D.C.
hear
in April
our voice.
talking about this.
All right, you two, thank you both
I agree
very
with that,
much.
and that's why we're on this program right now.
That's right, and we're going to have you
What we need
both
to see
back
happen.
so we can continue this small business summit. Thank you both very much.
Thank you both. That Patty she's quite a firecracker.
They both
I love her.
are.
Yeah, David on too. All right, guys.